Hello, and welcome to the overview of Leadership and Governance module of our training on Leadership and Governance in Primary Healthcare, Insights from LMICs. In this module, we'll delve into the fundamental aspects of effective leadership and governance within the context of primary healthcare systems in low and middle income countries. Leadership has been described as the behavior of an individual when directing the activities of a group toward a shared goal. The key aspects of the leadership role involves influencing group activities and coping with change. Leadership within healthcare systems encompasses several critical aspects, which we'll examine in detail. Leadership in healthcare involves encouraging individuals to willingly take ownership and responsibility for their roles, thereby contributing to the achievement of collective goals through influential guidance. Effective leadership in healthcare involves persuading team members to follow directives and embrace the leader's vision for a common purpose. Leadership is viewed as a social influence process that seeks the willing involvement of co-workers to meet organizational goals. Followers are crucial for the leadership process. Leaders and followers often interchangeably assume their roles. Leadership is key in molding the organizational culture and ensuring that there is a clear direction, alignment, and commitment within the teams and the broader organization. In the context of healthcare, leadership is specifically about health managers' ability to lead their teams effectively towards the desired health system outcomes. Health managers are expected to employ leadership skills in addition to managerial authority to lead their institutions effectively, implying a balance of power and influence. Health system governance refers to the rules and norms that shape roles and responsibilities, incentives, and interactions in the health sector. Governments play a major role in setting the governance arrangements in the health sector. They act through a broad range of legal, policy, planning, and monitoring instruments. Governance involves the process by which collective choices are made and implemented within society, organizations, and groups, emphasizing the transition of decision-making from individuals to governing bodies with established accountability systems. The fundamental aspects of governance are detailed as follows. In healthcare, governance refers to the manner in which power and control are distributed among stakeholders over health facilities, aiming to serve the community's best interest effectively. It includes a broad range of stakeholders who collaborate, share interest, and participate in the control and improvement of the health system. Strong leadership is crucial for good governance, facilitating interagency collaboration, clear roles, and a focus on meeting the needs of clients, patients, and healthcare providers. There are significant variations in leadership and governance approaches within healthcare systems, with the goal of enhancing healthcare effectiveness through stakeholder engagement and support. Governance frameworks provide strategic direction, establish accountability arrangement, and ensure transparent decision-making, thereby supporting leadership in achieving health system improvements. Effective leadership and governance are essential for enhancing the performance of healthcare systems and achieving universal health coverage, underlining the importance in health system improvement efforts. The interrelationship of leadership and governance within healthcare framework is composed of essential components: foundational role, coordinating function, operationalization, role definition, and performance enhancement. Let's delve into the specifics of these crucial points. Leadership and governance are essential, acting as the bedrock that supports the functionality of all other World Health Organization building blocks. They establish the core framework for policies and regulations that guide the entire health system. They ensure coherence and synchronization within the health system, facilitating the efficient and effective operation of all health-related activities. Their role in coordination is key to improving the system's overall performance. Leadership and governance are manifested in the establishment of new organizational practices and policies. They encompass the strategic utilization of resources, the proper allocation of staff hours, and the fulfillment of both clients' and providers' expectations. Their influence extends to the ability of health facilities to acquire, employ, and oversee resources effectively. These elements help health managers and various stakeholders, including communities, civil societies, and the private sector, clarify their responsibilities, limitations, and impact on the provision of health services. Clear role definition is crucial for accountability and direction. Effective leadership and governance are instrumental in raising health workers' performance to the desired standards. Through critical leadership decisions such as recruitment, training, development, and motivation, health managers can substantially boost worker performance. Let's discuss how leadership and governance within healthcare organizations can be effectively operationalized to ensure responsible management and uphold accountability standards. Leadership and governance in healthcare can be operationalized through the introduction and enforcement of new organizational practices and policies. This enhances the efficiency of health services, ensures the proper use of resources, and aligns staff actions with strategic objectives. In the health sector, leadership and governance involve the strategic utilization and management of various resources, including human, financial, and material assets, to deliver high-quality healthcare services. Effective leadership and governance aim to optimize staff working hours and improve overall efficiency, thereby maximizing productivity and improving healthcare delivery. A key goal of leadership and governance in health is to increase the satisfaction levels of both clients and providers through responsive and high-quality service delivery. Leadership and governance are crucial for enhancing the capacity of health facilities to effectively manage resources. This includes planning, procurement, and utilization of resources to meet healthcare demands. Clear delineation of responsibilities and the scope of influence for health managers and stakeholders is essential for ensuring effective governance and leadership. This involves establishing boundaries and roles within health service provision. The 8 critical pillars of effective governance in healthcare include participation, transparency, accountability, responsiveness, health equity, effectiveness and efficiency, rule of law, and ethics. These elements are essential for managing and assessing health services in a way that is efficient, fair, and responsive. Let's examine these key components more closely. It is essential for all significant stakeholders in healthcare to provide input in decision-making processes. This ranges from assessment to management and evaluation, allowing for a direct or representative contribution to health discussions and decisions. Empowerment in healthcare governance is achieved by giving stakeholders control, fostering the exchange of information, and encouraging deliberation. This enables a sense of ownership and a more responsive healthcare system, as it hands a degree of control to stakeholders involved in healthcare decision-making. Recognizing patients as central stakeholders in healthcare. This module discusses how their preferences can vary regarding the extent and form of their participation. This reflects the diverse nature of their engagement and the need for healthcare systems to accommodate different levels of involvement in healthcare interactions. Let's explore the crucial role of transparency in healthcare leadership, which is fundamental for building trust, improving patient care, and securing accountability in healthcare systems. Transparency is vital for informed decision-making in healthcare, enabling access to essential information and data to improve health outcomes effectively. Transparency means providing open access to information, including audit reports and data, allowing stakeholders to scrutinize processes and hold institutions accountable. Transparency facilitates ongoing monitoring of healthcare activities and performance by providing visibility into processes and outcomes, driving accountability and fostering continuous improvement. Accountability is vital for ensuring that state institutions and health systems promptly address public needs and continuously improve healthcare services. Accountability mandates that healthcare managers and staff are responsible not only to their managers but also to the public and stakeholders they serve, ensuring transparency and quality care. Transparency in healthcare fosters scrutiny from stakeholders, building trust and enabling effective oversight within institutions and between institutions and the public, thus strengthening overall accountability mechanisms. Responsiveness in healthcare involves addressing and fulfilling the expectations of both clients and caregivers, ensuring their needs and preferences are met throughout the care process. Responsiveness is evaluated based on several factors, including how promptly services are delivered, the dignity with which clients are treated, the effectiveness of communication, and the availability of choices in care options. Responsiveness encompasses multiple dimensions across various aspects of health service delivery, indicating its comprehensive nature in addressing different facets of patient care and satisfaction. Health equity ensures that individuals have equal opportunities to enhance or maintain their health and well-being, regardless of their background. Health equity aims to prioritize the needs of those at high risk of poor health outcomes due to their social circumstances, ensuring targeted interventions for these groups. The equitable allocation of resources is a fundamental aspect of health equity, requiring that resource distribution considers social arrangements and the different levels of social advantages or disadvantages. Processes and organizations within healthcare should produce results that align with the needs of the population, influencing health outcomes positively and ensuring that resources are utilized optimally. The emphasis is on outcomes that truly reflect the goals of health services and on using resources wisely to achieve these goals. Health organizations are evaluated based on their effectiveness and efficiency. Effectiveness is measured by how well an organization achieves its mission and goals, while efficiency is determined by how resources are expended to realize these goals. Together, these measures provide a comprehensive view of an organization's performance. Efficient use of resources in healthcare is pivotal for achieving the objectives set by health organizations. It's about doing more with less, ensuring that every resource, whether it's time, money, or personnel, is used to bring about the best possible health outcomes. The rule of law ensures the fair enforcement of health policies, laws, regulations, and guidelines. It serves as the bedrock for the development of legitimate and effective institutions. Safeguarding human rights and upholding law and order are crucial for a functional health system. Ethics involves adhering to established healthcare principles in service provision and research. It's crucial for setting organizational objectives and making decisions, especially as healthcare organizations face new ethical challenges due to changes in healthcare delivery and financing. Ensuring ethical standards is essential for maintaining trust and integrity in healthcare. As we wrap up this online training course on leadership and governance in healthcare, we reflect on the valuable skills and insights gained. You have explored the essential elements that make a strong leader in the health sector, from strategic vision to ethical governance. The course has empowered you with the knowledge to navigate the complex healthcare environment effectively and to drive improvements that can transform patient care services. Your journey doesn't end here. Let these lessons be a springboard for further learning and leadership opportunities. Carry forward the governance principles and leadership strategies you have mastered and continue to make a meaningful impact in the health community. Thank you.